We will be discussing a vulnerable group known as low-income families. Here are a few objectives that we will cover throughout the presentation. Low income, also known as poverty, means that they do not have adequate resources to meet basic living expenses. There are two different guidelines: poverty threshold guideline, which is mostly for statistical purposes. Then there is federal income poverty guidelines, which determines financial eligibility for services regarding a federal program. This chart in our textbook contains the guidelines in 2013. You'll see a family of three, 19,530 is the guideline. In 2016, the federal poverty level, FPL, was set at 24,300, so that was a 3-year difference, and that was for a family of 4. In our textbook, there was an interesting fact. In 2009, more than 43 million people had incomes below 125% of the federal poverty level. And then it started to say that people that have a slightly greater income level compared to those guidelines and are not able to meet their living expenses are not eligible for the programs that the government offers. So we looked at the yearly income, but what does that break down to hourly? Well, this chart does an excellent presentation. So we have $9.25, $10.75, and $13.50 are the actual wages. Moving on to vulnerability and marginalization. Breaking this down to society and healthcare. For society, people with less income are at higher risk to live in dangerous environments. They are underemployed, unemployed, or they work high-risk jobs. They have many stressors, and they eat food that isn't as nutritious. For healthcare, we have low income puts people at risk for a lower quality of life. This can lead to health problems, and it can lead to a larger amount of diagnosis regarding mental illness. More examples for healthcare. More low-income children are living in crowded, disorganized, unstructured settings. So this contributes to a decline in the child's health. This increases their exposure to toxins, germs, and they have lack of emotional support, and then they can get into more accidents because they're unsupervised. They also have inadequate public transportation, so this interferes with them arriving to their health appointments. Another example for society. So stressful circumstances arise from higher instances of financial difficulty, job instability, and inability to manage stress in healthy ways. They don't have the money to get a gym membership or do yoga. It is estimated that around 200 million children under 5 years of age in low-income countries fail to reach their fullest developmental potential because of poverty, poor health, malnutrition, and lack of learning opportunities. A study was completed that showed a correlation between low income and lower quality of life does exist. So it's not that they have a direct correlation, it's because when you have low income, you normally have a lower perception of self, then a lower quality of life, and then that lower self-perception can lead to a mental illness. Social justice in terms of wealth, opportunities, and privileges, this group has issues with it. For example, unstable housing, complications with insurance, lack of education, food instability, employment. They can't become employed or they're unemployed. As far as insurance, Medicaid is intended for low-income individuals, but some individuals do not qualify because they are slightly above that FPL. Moving on to access and equality of care. It is very hard for an individual, specifically low income, to go to a healthcare service and have all 6 of those measures: approachability, acceptability, availability, accommodation, affordability, and appropriateness. This group attends safety nets, which are emergency departments and urgent care clinics, because of insurance. Lower socioeconomic status have increased risk for cancer and chronic conditions. They lack transportation or insurance. Safety nets can combine services for children and adults. A significant barrier preventing access to care for low-income families and children is the complication with health insurance. This slide discusses the lack of education, low-risk perception for health problems. They also usually go after handouts and television, not what the doctor says because they don't go to the doctor. Solutions would be education, public transportation, and revamping Medicaid. Food assistance programs, Head Start, and healthcare clinics are resources.